Blood pressure can vary from minute to minute with changes in exercise, stress, sleep, and posture. But it should normally be less than 120 over 80. Molly, can you please tell us, what does that mean?
So blood pressure is recorded as two numbers and it's written as a ratio. The top number, called the systolic blood pressure, measures the pressure in the arteries when the heart beats or pumps to the body. The bottom number, or diastolic blood pressure, is the amount of pressure in the arteries when the heart is resting and refilling with blood between heartbeats.
So when is blood pressure that is too high or too low?
So high blood pressure or hypertension is when the force of the blood flowing through your blood vessels is consistently too high. And there are a variety of factors that are linked to high blood pressure. These include things like family history, age, gender, race, an unhealthy diet, especially one that is high in sodium, drinking too much alcohol, smoking, being overweight or obese, lack of physical activity, and stress. Hypertension has few or no symptoms, but it can permanently damage the heart, brain, eyes, and kidneys even before an individual will feel that anything is wrong.
So how often should you have your blood pressure checked?
So the American Heart Association recommends blood pressure screenings also begin at age 20 and that they continue at each regular healthcare visit or at least once every 2 years. Now, if your blood pressure is consistently higher than 120 over 80 milligrams of mercury, you may be asked to measure it more often. Blood pressure also can be checked at home with an over-the-counter blood pressure monitoring system between healthcare visits, but this should not take the place of monitoring by a healthcare provider.
So bottom line, how can a person maintain a healthy blood pressure?
So maintaining a healthy blood pressure can be simple and easy. And I think you'll notice some familiar threads. Eating a diet rich in fruits, vegetables, whole grains, and low-fat or non-fat dairy products help to maintain a healthy blood pressure. Another important thing that can directly affect blood pressure is avoiding excess salt. Limiting alcohol is also key. Physical activity, once again at 150 minutes a week or more, is essential. Maintaining a healthy weight remains important. Managing stress also helps to maintain an appropriate blood pressure. Tobacco products should be avoided. Caffeine should be limited. And for those who may have some issues with blood pressure, monitoring that blood pressure at home can be helpful. And of course, all individuals, whether or not they may have problems with blood pressure, should continue to talk with their healthcare provider about their blood pressure numbers, if there is a need for treatment, and if medication is recommended.